Abortion. Who is right? Is the fetus a person in the womb? Do they have rights? Or is it all up to the mother? What about the father? Does he have a say? I do not want to get too in-depth on the issues. Instead, I will be focusing on the right to an abortion with the mother's choice as the only variable. The fetus will not be considered a person for these purposes until 24 weeks, when the baby would be able to survive outside of the womb. This will limit the viewpoints greatly and keep us focused on the issue at hand. If it was known that a baby would be born with medical complications and testing could prove it was certain, would abortion be an option? In the first trimester, 0 to 3 months of pregnancy, blood work is done between 6 and 8 weeks. The blood work will determine if the beta-HCG levels are high, and that may be linked to certain birth defects. Another blood test is the PAPP-A, which is a pregnancy level associated plasma protein A. Low levels of this may indicate certain birth defects as well. These tests on their own are not diagnostic. They are only screening, which means more testing will need to be done to have a more concrete result. The next test that is completed around 10 to 12 weeks is nuchal translucency test, which is an ultrasound that measures the thickness around the baby's neck. Increased thickness is an early sign of Down syndrome. In these images, there is an ultrasound picture of a healthy fetus and an imagery of a fetus with likely results of Down syndrome due to abnormal ultrasound results. I use healthy lightly because at this age a fetus is unpredictable and may not be carried to full term due to many circumstances. Second trimester screening between 12 and 24 weeks includes more blood work and an amniocentesis. The quad screen needs to be done before 20 weeks with the mother's request. This is not a routine test, so not all pregnancies have this done unless there are concerns with the pregnancy. A diagnostic test is performed, which is called chorionic villus sampling, or CVS, to find out if the baby has a complication with development. This test uses a needle that is inserted into the abdomen to withdraw amniotic fluid for testing. This test does carry risk but does not usually cause miscarriage. You may be wondering how efficient these tests are. Studies have proven that the tests need to be done progressively, and all results must correlate to properly predict disorders. Nuchal translucency itself correctly finds Down syndrome in 64 to 70 out of 100 fetuses. First trimester blood work plus nuchal translucency correctly finds Down syndrome 82 to 87 times out of 100. The amniocentesis, quad screen, and the first trimester test find Down syndrome 95 out of 100 times. These results may assist the mother in determining how many tests she will put herself and the fetus through to make an educational decision. The category of people that need to be more concerned with the risk of Down syndrome or other genetic disorders during pregnancy include mothers over 35, mothers who have ethnic backgrounds associated with high risks such as Tay-Sachs, sickle cell anemia, or cystic fibrosis. Mothers with a family history of previous birth with a genetic condition, and mothers who have had prenatal screening that shows an increased risk of genetic disorders. Things that a pregnant mother would need to consider if they had positive results would be to meet with a genetic counselor to determine the risk of the fetus developing the disease. The mother now needs to determine if the results are risky enough for them to consider ending the pregnancy, adoption, adaptation, or further testing. At this point, we will focus on the decision of abortion being the only solution for this mother who had positive results for the test. We will make this easier than saying, oh, this child has a 65% of risk of having a lifelong illness. Instead, we will phrase it as, this fetus, who is 19 weeks along, has a 95% chance of being born with Down syndrome. It does not matter how many children are at home, financial means, or support the mother will receive. We will use this as a black and white example of the mother who can provide for this fetus, but is aware that it only has a 5% chance of being healthy. A cultural relativist would look at this as Abortion is not socially approved, therefore it is not good. Since it is not good, it cannot be done under any circumstances. A subjectiveness in the eyes of the mother only. Remember, we're not considering a 19-week fetus as a person. X is good, therefore I like X. This would mean abortion is good, so I like abortion in this mother's eyes. But abortion is not considered good under most circumstances, therefore abortion is not good and we do not like abortions. Supernaturalism. Abortion is good means God desires abortions is not a statement that would be heard due to the Ten Commandments. Thou shalt not kill, and even though we are not considering this a person, it would still fall under the category of killing in this context. Prescriptivism. Under circumstances, abortion will be performed. If one follows certain guidelines, all will follow these same guidelines in similar situations. This would allow abortion to be permissible in the same circumstances of positive testing and allowing the mother to choose abortion once diagnostic testing is done and the mother is educated on the situation at hand. Many will not follow such a rule to permit abortions if the criteria as designated above is met. Consequentialism. If abortion maximizes good consequences, it doesn't matter. We can do it. With that statement, abortion would improve the life of the parent by decreasing the stress of carrying a pregnancy to term that may not survive outside of the womb. And if they do, they may have a very poor quality of life and live in pain, as well as decreased future medical expenses if an abortion is performed. This viewpoint would have more good consequences than negative, but if somebody else had written it, that may change. So each person would have their own viewpoint of good versus bad consequences based on what may be affected for them personally. Non-consequentialism states that some actions, such as abortion, would be considered killing the innocent and is wrong in itself, so it cannot be done. This is very clear-cut and does not need to be argued. The following is an example of the tough decisions one family faced when they received this testing in real life. Gary and Karen were ecstatic. After 4 years of marriage, Karen was pregnant. Gary would finish law school in 6 months. The timing could not be better. Karen had always wanted a big family, but they had delayed till Gary would have a regular paying job. But after her third prenatal visit, Dr. Abrams called her at home. Could she and Gary come into the office at 3 tomorrow to review her recent test results? He would explain everything then. Over the next few weeks, ultrasound tests confirmed what the blood test had suggested. Their baby, if allowed to come to term, would have severe neural tube defect. In other words, the child would have an open spinal cord, hydrocephalus, mental retardation, and probably never walk in a normal manner. The burden that this child would experience and the pain the family would suffer would be unbearable. The best thing would be to have an abortion. Dr. Abrams gave the names of 2 competent gynecologists. It would be best for everyone. Everyone will have their own opinion as to how this situation should be handled. Those values were affected by our upbringing, religious views, life experiences. This is why it's such a strong topic of discussion in ethics, and I do not believe there will ever be an answer. I agree with limitations as to how pregnant a mother can be to make the decision not to continue the pregnancy. I also believe the father has a right to make the decision as well. The topic will always be debated and never be resolved. The credits include the sources I received images and information from. Thank you.